Our first responders in the state say they're reaching a breaking point. So they went to the Capitol demanding action from our elected lawmakers when it comes to adequate funding for ambulance services. Danny has more on what these EMTs are asking for and what could happen, they say, if they don't get it.
In emergency medical services, seconds matter.
From the heart of Minneapolis to the rural communities that define our state, Minnesotans rely on us.
But Michael Juntanen with the Minnesota Ambulance Association says the EMS system is on the brink of collapse.
The consequences of underfunding and workforce shortages are real and have serious implications for Minnesotans. Services are being forced to cut shifts, lose staff, and in some cases shut down entirely.
With low reimbursement rates from government programs like Medicaid, many ambulance providers are losing money. And due to burnout, the industry nationwide is projected to fall 40,000 workers short by 2030.
This is a moral imperative issue.
DFL Senator Grant Hochschild represents a rural district in northern Minnesota that's been hit especially hard.
In our rural communities, we are not seeing the sustainability of ambulance services for people when their lives are at risk.
Last year, Hochschild helped pass $30 million in one-time EMS funding, largely for rural providers. This year, he's pushing for $50 million in ongoing funding per year, along with other measures to bolster workforce training and increase the Medicaid reimbursement rate.
If we're going to increase the Medicaid match, it has to be targeted at rural communities, because frankly, that is where people are drowning.
On the House side, Republican Representative Jeff Backer, a volunteer EMT himself in western Minnesota's Browns Valley, is taking the lead on EMS issues as co-chair of the Health Finance Committee.
We have to back the system, and that's what we're working on, is solutions.
While there's bipartisan support for EMS funding, lawmakers in the tied House are negotiating the best path forward as part of the broader budget process.
EMS has not been a priority for the state. What we're looking in on our side of the aisle is how we deliver health care good. We're looking at the services.
EMS funding will be debated as part of the broader Health and Human Services spending bill in both the House and the Senate. Once the two chambers pass their own versions, they'll have to come together to find common ground and then agree on a final bill that the governor would be able to sign. At the state capitol, I'm Danny Spiewak, KARE 11 News.